Fatu Network. Somebody was supposed to call me. What's the time now? Somebody was supposed to call me and I need to communicate. Are we ready to go? Are we ready to go? I'm waiting for you people to give me the go ahead. Are we ready? Ker Fatu? Hi, Africa.
They are no longer complaining of social distance because they are
You see?
violating the rules. You have them. You guys are
These people, they started violating the rules for so long. Wow. Okay, you can sit. Okay. Thank you. Once again, I wish to take this great opportunity on behalf of the Minister of Health to welcome you all to yet another session where a statement will be read to you detailing out where we are, what we have done, and what we intend to do with regards to COVID-19. Again, we must have to thank you on a daily basis. Thanking you is not a waste because you have been there for us. We started sailing together and we are still cruising. I'm sure by the time we will anchor, we will all celebrate together. Why I'm saying this, anytime we call you, the media, you're always here to come and give us the support. This is the type of support we expected, and we have been seeing the support coming from you people. Whatever we collect from here, it is always taken to the various media houses. So we thank you who are the ones who are coming, traveling to and from your media houses. We also want to thank the managers, the executive directors of the various media houses that are giving you the opportunity to come and attend our press briefings on a daily basis, and also supporting you to come and attend. So on that note, I want to thank you, and today I'm here with Dr. Bite, Sankanu, Madam Dr. Drame. So I want to say that the discussion will start with Dr. Bite, who will read out the press release on behalf of the Honorable Minister of Health, Honorable Hamid Lamin Samate. From there, then we'll also have a question and answer session, and I'm sure which is going to be facilitated by Prince Abubakar Aminata Sankano. That is his full name, and I really happy to really complete his name, and that is his. That is also because if you are calling someone, you have to complete the name. So he will facilitate the question and answer session. Without wasting much time, I now call on Dr. Mustafa Bite, the Acting Director of Health Services, to read this statement on behalf of the Honorable Minister of Health. Dr. Bite, welcome.
Good evening once again. The Minister of Health would like to update the public on the situation of our national response to the COVID-19 pandemic. The 19th National Situation Report, since confirmation of the first case of the novel coronavirus disease in the Gambia on the 17th March 2020, revealed the following through government's ongoing monitoring and testing program as of today. 1. The Gambia records no new laboratory confirmed COVID-19 case. 22 laboratory test results were received from the Medical Research Council laboratory, 20 of which turned out negative. The two remaining results were those of the active case and the probable case. While the active case remains positive, that is the patient still under our treatment, the probable case still came back as inconclusive. Since the beginning of the pandemic, the country reported a total of 4 confirmed cases and now 1 probable case. All 4 confirmed cases were imported. Currently, we have 39 people on quarantine in one of the hotels in the Greater Banjul area. A total of 195 tests were conducted and 4 were positive, 189 test results were negative, and 1 is inconclusive, even though it was done twice. We urge the general public to follow the government's guidelines on the preventive measures against COVID-19. We would like to reiterate the need to stay at home to protect ourselves and our loved ones. The general public is advised to remain vigilant and to call our toll-free number 1025 for guidance and for sharing of information. It is only with collaborative effort and spirit of unity that we can tackle this pandemic. I want to reassure you that every arm of the government is doing everything possible to rise to the challenges that comes with this pandemic. On that note, we thank each and every one of you for your collective effort as we intensify our actions towards halting the growth of this COVID-19. Together, we can make a difference, and thank you very much for your kind attention.
Thank you, Dr. Biteye, for the statement. I now invite Prince Abubakar Aminata Sankano to facilitate the question and answer session. Mr. Sankano.
Thank you very much, Mr. Modou Ndiaye, Director of Health Promotion and Education at the Ministry of Health, and also the head of our risk communication team of the National Health Emergency Committee. Thank you very much, Dr. Biteye, for that reassuring statement. As usual, it's encouraging. And now we open the floor for a few questions for the day. You can answer your question, your name, the media organization, and your question, please. Yes.
I'm Lamin Sante, iAfrica TV. Used to a week since the National Assembly extended the executive request in state of emergency. The current movement of people in the town, if it is anything to go by, do you think the Ministry of Health requesting the government for this state of emergency will be achieved in terms of looking at the number of movements that are currently happening, the stay home campaign and the hand washing? Do you think you will be able to achieve the main objective of this state of emergency?
Thank you very much for that question. Before coming in, I'd like to give Dr. Biteye and Mr. Ndiaye to answer that question.
Much, very important question. I think the government has done a lot instead of by actually closing schools, by allowing non-essential staff to stay at home, and by bringing this very important issue before the National Assembly to ensure that we can have the state of emergency. So I think it is also upon us to try to do our best, because if you are not going to school, as much as possible, stay at home. We don't want to see the youths playing football, playing nawetan, what should not, these are the things happening. But if we understand why this is done, that this is a very serious disease, and you are given this opportunity, you have to utilize it, not to misuse it, and not to abuse it. So I think with more enlightenment from the media and from the health personnel, from the general public, people will understand the purpose behind the reasons for all these actions, and then they will take it upon themselves to ensure that they don't go ahead, they can stay at home. Because if it is only an educated and somebody who understands, like Mr. Njai will tell you, risk behavior, before you can change your behavior, you need to understand very well the impact, the implications it has. So if we educate them, keep talking to them as a media, then it will help them to understand why these actions are taken. So there won't be need for policing, and policing will be a last resort. So we should all continue to educate, and then we sure the populace will come on board.
My question is not answered. Be more specific. To achieve what you want, that is Gambia corona-free.
So what I'm saying is there's a lot of work that needs to be done in the population. It's not about policing. It's not about forcing people. It is about getting them to understand, and they also take part. Policing is the last resort, which we will reach if the need arises, and you can see that it's a gradual process. But what is happening now is, for me, what I advocate is that we educate them as much as possible. And these actions, we are advocating for it. And once it is put in place, then you will see the police everywhere to enforce it. Thank you.
Thank you, Dr. Bite. Mr. Kante, your question is very good. You are asking whether we are confident that we can achieve the COVID-19, we can be able to achieve it. We can, COVID-19 free Gambia, am I right? That's what you're asking. With this current trend, that particular, if you look at the social distancing and the issue of suspension and public gathering, is one aspect of it. That's one aspect. But if you look at our level of response, and before the response, our level of preparedness, we are very confident that we can also be able to make this country COVID-19 free. We are very confident. Why I'm saying that the structures are already being established, and we have both national, regional, district, and community levels. You'll be surprised that even village development committees are taking up the responsibility to ensure that they check out the movement of people within the village, especially borderline communities. The village development committees are also taking up the responsibility to take action as to what should be done in preventing COVID-19. So we are very much confident as a ministry. We are not doing it alone. We are with so many ministries are part of this process. The whole government is part of the process. You, the media, are part of the process. So the way we are going, the speed we are going, I said it at the beginning, the way we are sailing, I am very confident that we can be able to do it. Because why I'm saying, because the structures are already in place. Now the government is also supporting the Minister of Health, and then we are also getting out to strengthen our health systems, as well as also trying to refurbish the isolation centers, also trying to have a functional treatment center, quarantine center. A lot of things are happening. So let's work together, as Dr. Bide said. It is you, the media, who can help us to change people's perception. And one of the challenges we have right now, many people feel that they don't believe the COVID-19. That there is corona. That's what they are telling us. But that's their mindset. That's how it is. You now, the media, who can help us to change those beliefs in the public. That's also very important. And also, some people are also still living in denial. So we all know if somebody is in denial, how long will it take you to move that person from that level to another level? So you can see that all the media has a role to play. If we all put our forces together, we can be able to tackle COVID-19 in this country, and we can make it COVID-19 free. I'm very sure of that.
Thank you very much, Mr. Njai and Dr. Bite. To add up, just like the lady once from Talent Television asked about that, we said that, as Dr. Bite said, force is going to be the last resort. And the government believes in educating the people. We want to consolidate a reasonable state whereby every action that is taken is calculated and measured. So right now is educating the people, and Mr. Kante, as you ask about, the state of public emergency, it is done for public good. That's why if you look at the caption, state of public emergency, it is in the public interest. And I believe that, gradually the public will understand it, and there will not be need to use force and then implement it. Of course, in certain cases, like as we can see in price hiking, we give people time to respond. Those who are trying to be defiant, the law took its course on them. The same thing when it comes to social distancing. Those who respect the rule, we thank them. Those who are not respecting, last week we went around the country, we've seen that, the law enforcement authority are taking action. So the government is, as I say, it's not dictatorial. It wants to carry along, take the population along in this measure. I believe that we can have zero COVID-19 in this country. It's possible if we work together. And we should not forget that as long as our neighbors continue to have this pandemic, we should remain vigilant, as Dr. highlighted in his speech. Any additional questions?
The way it is spreading from Asia, then it went to Europe, then from Europe now it's in America. And WHO, they are predicting Africa will be the next epicenter. What is the ministry's reaction to that?
Before allowing Dr. Msonga to come in, somebody asked me this question today, I answered the traditional Gambian answer.
It bites, it doesn't bite, let it not enter your trouser. So whether it is biological or organic, let's prevent ourselves from catching this corona. Let's save our country and our political economy. On that note, I give Doctor the chance to elaborate, or Mr. Bitti, because it's too political and we're going to... Doctor?
Thank you very much. I think it's stated. So this is predictable because, from the science, you could see even long before it came, they can tell you there are a lot of studies that showed that, for example, based on projections, that it was going to peak in the Gambia around 15th of May. And when it started the same here, and we did our projections, we also had like it was going to peak around 17th May. So there's a lot of, based on, a lot of modeling and all that, that's how they come to realize that this is how we think it is going to take. It doesn't mean that it's going to be 100% that, but you could see some studies that will tell you, that have predicted that around, using modeling science, they can say that, okay, we expect that this is what is going to happen. And with those modeling, they've given us different values as to what to expect in the Gambia, if there's good social distancing, if there's not good social distancing and all that. So there's a lot of science that underpins most of the predictions that happen. So like he said also, Mr. Sankara, it's very important for us not to be involved in conspiracy theories or what is happening. What is more important for the Minister of Health and in the country is to ensure that the people are safe, the people survive this pandemic. And we need to put in precautions. Let's engage our minds and be preoccupied with that. After all this is done, then let's do the research to find out how it all started and what happened. But as of now, let's save the people.
Yes, you want to add up something on that?
No, just to say that people can make predictions. People can also make, they can think anyhow. They have the right to think anyhow. This is about science, as Dr. mentioned. Basically, you think about something and you feel that the disease is coming from Asia to Europe, then to America, then it will end in Africa. That is your perception as a scientist. And then whatever we see, another scientist can think that maybe it will not even come to Africa. Another scientist, or it may not stay long in Africa. So that's the way people think. So we have to accept it that way. But what we need to do now is to make sure that it doesn't come to the Gambia. It has come. 4 cases, let's stop there. We just need to make sure that we work very hard, as we have been doing before, so that it stops there. Because we know in Africa, for example, that somebody might think that, okay, it might come to Africa because we believe in traditions, we believe in being together. I mean, we all know in our African setup, people want to be together all the time. And we are promoting social distancing. And that is why we have to go out to do dialogue with the opinion leaders, which we have done last week. And we went out to have a dialogue. Dialogue is very key. We heard from some of them. Some of them, they made certain opinions that they feel sometimes discouraging, but you can see within the same community, somebody also will come with a different opinion, which is very encouraging. So as we are moving, the laggers, those who are behind the ladder, at some point, they will also catch up. And they will start to adopt the behaviors that we are promoting. So we have to make sure that we promote this idea of social distancing. We have to promote it. Whether we like it or not, that's the only way we can also break the cycle of transmission. Remember, we are trying to ensure that we don't have local transmission. That is our agenda, and that's the agenda of everyone in this country. So let's work together so that we can break the cycle of local transmission. So with all the talks you'll be hearing, but what I also want to emphasize is that let's not listen too much to the social media. Let's be very focused. If you need information, this press briefing on a daily basis will provide you adequate information. In addition, we have a 1025, which anyone can call. You get more information. Or you can easily walk to any of the offices at the Ministry of Health, get more information. But what is bad is to make speculations, or to sit at your corner and produce an audio and circulate and say, this is what is happening, or you look at certain news, you go to social media, you want to pick certain things that definitely you don't even make any consultation. If you have any doubt, we're all here. You can just come. We give you all, we are so transparent. We decided to make it very clear here. We are so transparent. Our process and procedures are all transparent. You come, we give you whatever information you need. And I even promise that at some point, we'll also be presenting on the financial, the disbursements and so on, and it's been expenditure. So let's work together. Together, we'll make sure that it will not do more harm in this country. And that's the belief, and I believe that's what you also believe. So let's work together as we are doing. Just continue to support us. We'll also try to continue to support you, to give you the information, and you help us to get the information to the people that matter. These are the people that, for example, in your local news, like local language news, you can also try to explain more about what we've discussed here. We'll also continue to do more programs in local languages, like so that we interpret our press briefings or press releases in local languages. But before that, you also need to continue, and some of you are doing, just continue doing that so that we can increase the level of awareness. When people are aware, be rest assured, we can definitely fight this disease. It will not do more harm in this country. That's what we can do together. Thank you.
Thank you very much. As you say, we are doing our best. That's why, we stopped now at 4 cases, and which means that our actions are working. If I told we wait until we have 100 cases, what I get said is, this government will die, or we are paying them, they are doing nothing. Now we are doing something, at least, progress is made, and yeah, it's very good that, it looks good for our country. Let's continue to work together, and I would like to thank Gambians, especially for embracing the culture of caring and sharing. People mobilizing resources, giving it to the poor and the needy. This is something that we know about our culture, especially in these trying times. One more question? Oh.
Yeah. Still not satisfied.
Yeah, what do you want to know?
Either you are just...
I think it's what you want to explain.
No, what I want to put across is,
yes,
we have seen nations like Italy, France and others, in which they impose state of emergency. But the citizen doesn't take it seriously. When things move up to a certain level, that's the time they also tighten their belts. As of yesterday, even in the UK, you are found on the street without proper documentation of your mission out. You are fined of £1,000. Are we waiting to see cases in the country before we can tighten our belt to really impose this state of emergency, what it really calls for to be in place?
We don't want to be in a situation like Italy, Great Britain, or United States. We don't want. No one is praying for that situation to the Gambia.
Many think that we are on that trend.
No, we are not on that trend. How many cases have been registered for?
In a sense, people are not taking this state of emergency seriously.
We are giving the people to understand, as doctors say, we are sincere. I tell you, the state has the machinery. We have the capacity to apply force. We went on tour. Some people say they have to pray by force. What happened? The paramilitary went there and then dispersed them, surrounded the whole mosque, and they went. And remember, when they were asking for state of emergency, I said, all of people, you just want to see the cavalry in the States. I said, no, we are in a very sensitive situation. Educate the people. This is a matter of health. Gradual, carry the people along. That's what we believe in. Today we can apply. The state machinery is there. We can. If the president gives an order, it will be implemented. But we are giving Gambians the chance, to do. Like I say, you are complaining that some people are not going to. No, I'm just saying. For example. Yeah, we understand. We understand the public. Some people are saying that they are not going for that business, but mobilizing efforts are being made so as to support families, those who can't. So if we impose state of emergency, we apply it consequentially, as you are seeing in Italy. As a government, we have to make arrangements for the people. And all these things are being planned. The Minister of Finance, there is a higher committee that is meeting. All these, the concerns of the public are already being taken. So something is being done. When we reach that level, today, the state come and give you a bag of rice and all what you need today. If I see you at AM on the street, then I'll arrest you because you have no reason, because you've already been provided with a bag of rice or ingredient for the day. So we are working towards that level. But we don't want to be reach a situation whereby in Italy or France where 10,000 people are dying. No one is praying for that situation. So I think. Well,
think the country is in a position to provide what the people are looking for?
This question can be answered next week, because this is a question that we answer in Parliament.
The parliamentarian and the minister will reply officially. We are technicians. Even if you have the information, we cannot give it. They cannot give us one day. Just Parliament last week. Government has to work on it. It's a machinery, and they'll give you an answer update. So bear with us. In the coming week, you'll get more information on that one. Doctor, if you have no question, you have to add something.
Kante's question and concern. I know you are. Yeah, it's a very good question that it has to. The state of emergency must be implemented. Remember, we started a long way. Before the state of emergency, we have been applying certain strategies, and we had the suspension of public gathering, and then from there we went into full state of emergency. You don't expect like arresting to be done now, but we can still continue dialogue. Dialogue is ongoing. We're engaging the various institutions like the Supreme Islamic Council. They are doing that. The Christian Council, their part, other council of so there is a lot of that going on. People are educated. You know, the state of emergency procedures have been explained to people, and these activities are ongoing. All the regional governors are doing their part. So basically, what we expect to see, we don't want those things to happen. We don't want to go into a state of policing, like trying to go in for, looking for some, who is that person? No, you must be arrested. No, we want to make people themselves to take action. We will give you one example. Typical example is Sabi in Upper River region. Sabi has 8 exit points to Casamas. What they did was, like, each and every exit, they put someone with a motorcycle, 2 people. They call them community vigilantes. And this has been also replicated in other parts of the country. Why they are doing this, and the VDCs are supporting them. Now the communities are now taking action on their own. The communities are now being responsible because they have been educated, they know what is going on, and they've taken action on their own by supporting the community vigilantes to go and do patrols on the borderline. And you know what happened? When they started on their own, the Minister of Interior also supported them by giving them additional police officers so that they can also be protecting them along the way. So you can see what communities are doing. So gradually, certain communities that we are finding it difficult, they themselves will come back and start talking to other committee members. That is what we are even seeing now. So let's take it gradually and let's keep on talking to people. And you can see it at the beginning of the state of emergency, when it was announced. You can see when it started and now what is happening. There is a big difference. Certain markets you go, they close by 2 p.m. Certain people's movement have been limited. Why? Because they are getting more and more educated and they are getting to understand the issues. So we will want to appeal to all of you in your programs. Let's still start to emphasize this. And then the dialogue should also continue. Wherever we are, one-to-one, we can start talking. Because we felt that we can be sitting here talking to the people on the media, but they may not understand. But that's why we took it upon ourselves to go in for dialogue. We met the key people. These are chiefs, religious leaders, village heads, security chiefs, like the Divisional Commissioner for Police in North Bank, was also engaged. And then you can see that they're all into it together. And they also embrace the issue of multi-sectoral collaboration, which I think all of you are part of. Because when you talk about multi-sectoral collaboration, the media is key into it. So therefore, let's just continue working together. We start raising awareness. That will help us, rather than going in for the policing practice, like try to go in for, act like police officers. We don't want to go into that stage. We still want to educate. But whereas in areas where it happens that people don't want to respect the laws, then the law will take its course. That is by ensuring that they are either arrested or certain things will happen and they can be charged for that. So therefore, we don't want to go into that stage. We want to now encourage people to accept and to practice what has been advised for them to do. So therefore, Kante, I'm sure we'll continue this dialogue. And as you rightly mentioned, certain information we cannot give it to you now. As you mentioned, it was discussed at National Assembly. We wait for the response, and then when we get the response, then we can also come and discuss other issues. Thank you.
Final question. Tomorrow we can ask more.
Believe
in this. Because what people believe, most of the people I talk to, they believe that the government is having $500 million. So, and I'm just being real. Yeah. So it's like they're thinking like the government don't care about them. You understand? So the government only cares. It's because of, I think, it's the level of sensitization that the government should do to sensitize the people and tell them what is the use of this money. And because some people, even we did a voice or vox pop in the town, most people are thinking, when you ask them, even this 500 million, if you divide it into 2 million Gambians, some will tell you everyone will have 250,000, some will tell you 10,000. I'm telling you, I'm telling you, even a member of parliament was at the parliament, and he himself was saying, if this 2 million is divided according to the country, each will have 250,000. And that guy was a member of parliament. You understand? So if a member of parliament can think like that, what about the ordinary people?
Thank you very much. The minister did his best by explaining. Like I said, regularly, as part of it,
will come with figures. You know, there's a committee in charge of finance and procurement. Every week they'll come. And like I said, the minister was talking, there's an account of the center. Yeah. Yeah, that is going on.
What I'm saying, your level of communication to me is coming to talk in English. I'm thinking like the communication should be looked into and I don't know.
Thank you very much. Mr. MJ, talk about it.
Language, as Dr. Bitte said, this information, when government announces, since the president announced it, a whole government machinery, this is a total government response, as the minister said. Minister of Education, the kids sitting at home, learning online, is paid from this 500. And this 500 million they're talking about, what they say, if you divide it by 2 million Gambia, you're just going to get $250 maximum. You know, and we put investing in our common good, modern laboratory, as the minister, the other day talk about machinery, you know, more respiratory equipment, investing in our health infrastructure. You know, it's about a stimulus package for the economy. That's why it's called national response. We are responding and then putting money into structures that's going to benefit us even after the pandemic. So it's a massive investment action. All government sectors are involved, the security. I mean, the breakdown will come. The public will be satisfied. Be rest assured that, you know, all the information about every butut of the 500 million, how it is spent, all these tables, as long as we get it, you will know it. And it will be broadcast in all the local languages, online, offline, orally, and however you want it, even through the Kanyalengs. Everybody will know it. You know, people are just hungry, you know, for information, but let them give us. We have to follow standard operating procedures. It has to be accurate, credible information. That's why we don't rush. No matter how the public pushes us, we are always steadfast and come only when we have accurate information. On that note, I would like to end today's, interact. It has been very fun, interesting as usual, Dr. Bitte. Thank you all, Dr. Bitte, Mr. Njai, and the team, and the media corps. It's nice to have you, and Dr. Drame. Thank you all. See you tomorrow.
Just a quick reminder.
man kontaan bo mu ne boy nga nyim bata mu be taki tubabu du boy nga nakko do mu be doku boy ngaki na nyin kenni moy boy pura e bungolo nyi boro na bungo hani lento am futaje boy de jibe lu njumala ya fanya koy babun lola ama me ila bungo jibe abadane jara foyte lafta fula nyi man balwo kalam mu balwo fo balwo ko budlo ko fanan kele boy nyim bungo jala be nyamende abbe mu balwo la do ko
ñin kunne suniata ta www.baluwo.com anin baluwo isela bulloran jorangol be sang anila kudula asatare mambata jorangol membuko sementol kenyo babarol nil peruol woninga nyon jamal ta baluwo.com yin jorangol be sang ila dinkira bado adungite batala je anin baluwo ifangole marate la kudula